So my poster is titled Annual Diabetic Eye Exams in a Rural Population, Overcoming Barriers to Care with Retinavue. So this is a follow-up study, so I'm going to start by just giving a brief introduction on what we did to get to the follow-up point. So over in the introduction box, the American Academy of Ophthalmology recommends an annual screening for diabetic retinopathy for patients who have diabetes. And this is supposed to start at diagnosis for type 2 diabetes or within 5 years of diagnosis of type 1 diabetes. However, according to the AAO, although diabetes is the leading cause of visual impairment in working age adults worldwide, only about 60% of patients with diabetes get this annual diabetic eye exam. And so that's the problem we identified. We wanted to look at our local population and see if we could identify some barriers to care. So we looked at a cohort of patients with diabetes at the ETSU internal medicine clinic who had not had a diabetic eye exam in the last year at the end of 2022. And so in our first study, we found that our patients had an average of 2.85 years since their last diabetic retinopathy exam. And we concluded that COVID-19 kept patients from their specialist appointments. I'm sure everybody has seen that as well. And that 10.55% of patients in this cohort had previously had a diagnosis of diabetic retinopathy. And there was no statistically significant difference in that time for follow-up in the patients who had a diagnosis of diabetic retinopathy and those that did not. We also found a higher creatinine in those that had diabetic retinopathy and those that did not, which was significant. And we just noted that the record keeping of the diabetic retinopathy exams was inconsistent. So moving forward, how can we address these? The internal medicine clinic got a Retinavue scanner. So we're in the background yellow box over here. The digital retina scans have been used in a primary care setting to assist with completing those annual exams. And they're taken by any type of healthcare professional and then reviewed virtually by an ophthalmologist. And then we know that follow-up at primary provider and specialist appointments declined during COVID, but the CDC declared the end of the pandemic in May of 2023. So following up our cohort in 2023, we created our follow-up questions. Will the cohort return after the pandemic? Will the Retinavue be helpful in boosting these diabetic retinopathy exam numbers? How many patients can we get up to date in 2023? And then can we reproduce that creatinine value? Can we quantify the record keeping to illustrate how that provider to provider communication is working? And will diabetic retinopathy prevalence increase in our cohort? So I did chart review on the same group of patients. And moving on to the results, we found that 39.59% of this cohort got a diabetic retinopathy exam in 2023, which is great. 15.28% of those exams were done by Retinavue in the internal medicine clinic. Diabetic retinopathy prevalence was now 15.23% in the cohort, and records were present 53.85% of the time. So I'll highlight here in 2022, our prevalence was 10.55%, and in 2023, the diabetic retinopathy prevalence was 15.28%, and that increase was statistically significant. Our creatinine finding this time was not significant. It was higher creatinine in the retinopathy group, but not significant this time. And then our last box at the bottom, I did a breakdown between providers and assigned them different numbers. So you can see providers 2, 4, 9, and 10 saw the majority of the patients at the clinic, and they were able to get between 34% and 50% of their patients back up to date, which is great. And then providers 4, 9, and 10 used the Retinavue, and they used it about equally, about 20% of those exams were done by Retinavue. So some discussion. Obviously, the retinopathy prevalence has increased. And one interesting thing I'll point out is that 21 patients had that diagnosis in 2022, and only 5 of them got a 2023 exam. So we still have a lot of patients that are going sort of unaccounted for who already had been diagnosed with diabetic retinopathy. But we did note the Retinavue was very helpful. in boosting that compliance. And then some special considerations. There's our patients on hospice who can't go get their exam, patients who don't want to get an exam, and patients who haven't been seen in the clinic since 2020 or 2021. And it's hard to say, what they're doing or how that skews our results. But in conclusion, we can say that the retinopathy prevalence increased, and that is expected but concerning and makes us think that this is an important issue to help overcome those barriers, and that the COVID pandemic ending and using the Retinavue was very helpful in encouraging patients to get back in. And then something to look forward in the future, we saw only 53.85% of the time the records were present. So that could be a barrier that might be helpful so that the communication between providers is really clear and to help our patients get back in.